sometimes even I have referred a few of my friends to psychiatrists. Those psychiatrists have a crucial role in diagnosing as well as managing the patients medically. But most of the counseling part is done by psychologists. So I would like to request Shanki Kumar ma'am to share her experiences in counseling healthcare workers, especially doctors, and how does she counsel the doctors and especially medical students and postgraduate students. Over to you, ma'am.
Thank you so much for the question. First of all, I'd like to say, Bhushan sir, that was a fantastic presentation. I think you covered it all really beautifully. And answering your question, Dr. Venkatesh, I think an important point in counseling doctor or any person is to understand a doctor is as human as everybody else. Just because you're in the hospital, you're there to take care of the patients, to provide support. It does not mean you don't get hurt. It does not mean you'll not be anxious, you'll not be stressed. Rather, imagine the kind of burden and the kind of pressure one person has when they have the responsibility to take care of so many people. So I think first of all, understanding them with as much humanity as someone else continues to be the first thing. And second of all, like Sir rightly said in the presentation, I think being in the healthcare structure, it feels like you can't say no to people. So you actually overstretch your boundaries. You stop prioritizing your own self. You take care of that self once you've reached an extreme space where it's impacting you so much, like your normal functioning impacts. Like Aparajita ma'am was saying, that if the problem continues for 2, 3 weeks, that is when you understand that this has gone beyond. This needs to be addressed now. So I think when I'm counseling doctors and more healthcare workers, why just restricted to doctors, all the staff and everybody who helps to run healthcare organization, the first important thing is number one, take care of yourself. If you are less anxious, if you are more positive, you'll be a better doctor. You'll be a better person in that space. So, number one, you prioritize your own space by taking enough breaks, by making sure that in the evening you do a self check in. How am I feeling today? Is there something that's impacting my mind? All the traumas that a healthcare worker goes through stays in their mind. Sometimes in the evening when you're relaxing, you'll get a flashback from what a patient said. So I think learning to switch off after work is very, very important. But of course, in the balance that you understand, you will be there who will be actually addressing urgent situations as well. So balancing the two continues to be a paramount factor.